Word on the computer. Okay, hello. Just to get into the call some more, we are with Jen Cunningham, and she is a medical doctor. So, Jen, if you could share your story, that'd be awesome.
Sure. I am an endocrinologist in private practice, and I live in the Chicago suburbs. And I have been involved with Monat since the end of April, and I'm now an associate market builder after just over a couple of months. And I kind of got sucked into this partly because of my own experience with hair loss. I have rheumatoid arthritis, and so in terms of my personal story with that, I have had RA since about 2011 and have been on and off a lot of different medications for that, starting with methotrexate, which causes hair loss, as many people know. And then as I was having issues with side effects of other medications, ended up on one medication called leflunomide, which is associated in some people with a lot of hair loss. And so that was a couple of years ago now, and the medication actually worked decently, and it wasn't an injection, it was an oral medication, which was really nice, but I started losing gobs and gobs of hair when I was on that. And so I became one of my patients because I see people complaining of hair loss all the time, and I was freaking out over my own hair and, stocking up on biotin and, any shampoo I could find that was supposedly going to be helpful for dealing with hair loss. And meanwhile, just hair was coming out and coming out. And my ponytail was half the size that it had been before. And finally I contacted my rheumatologist and was like, enough, I can't do this anymore. And I'd put up with a lot of side effects from other medications, and it was the one intolerable thing to me. So I did this washout, which he was like, are you serious that you actually want to do it? And I'm like, yes, give me the washout, because you can stop the medication, but it takes weeks and weeks or months and months to get out of your system. Whereas if you do this washout thing, then you take a couple of packets of this resin binding medication 3 times a day, which is really unpleasant to choke down. And you have to do that for a couple of weeks, and that actually binds the medication and gets it out of your system. He's like, all right, I'll prescribe it, but you're not going to like it. And I sucked that stuff down, and it was bad. But I really was desperate to get rid of this side effect from the medication. And so I ended up on other medications. I'm doing very well, but I continue on the methotrexate, which triggers hair loss. And it comes and goes in cycles, but it continues to be an intermittent problem that's more annoying at different times. And that's kind of how Monat came to my attention in terms of, when my radar went up, when I'm like, wait, there's something for hair loss. And it was, also as part of an idea of what is out there in terms of direct sales that I saw it, because otherwise you don't necessarily come across it. It's not a common thing right now. So that's kind of how I first encountered it, was in the concept of direct sales, but my first reaction was more like, hey, this is for me. And so I contacted Vicky, my upline, about purchasing it. And as I was thinking about it, I'd kind of been contemplating doing something in direct sales or some kind of a side thing anyway, for extra income, and ended up jumping right in and signing up as a market partner, but not really knowing what I was going to do with that. I have a good job. I work 4 days a week as a private practice endocrinologist. I, have a family with 2 teenage kids at home. I'm busy. My daughter's about to start high school, and I've been thinking when she starts high school, I won't have to be picking her up from grade school anymore. My husband's going to be doing the whole taking the kids to school and bringing them home thing, just because of the logistics. And I thought, I'm going to get in the best shape of my life. I'm going to not have to be dealing with that. And instead, I've taken on this whole other thing. I'm going to have the best hair of my life and make sure everybody else has good hair. But the exercise piece, I'm still trying to figure out. So this is my new distraction. But anyway, this came up, and I kind of jumped in as a market partner because it fit for me. It really fit with my own experience with hair loss, and it fit with what I do every day as an endocrinologist. So I don't know how much you know about endocrinology, but we deal with hormones, and a lot of issues with hair loss tend to be hormonal. So, from an estrogen standpoint, people who are dealing with postpartum hair loss, or people who are going through menopause, either perimenopausal or postmenopausal, people who have excess testosterone, women with excess testosterone tend to lose hair. Those are some of the places where I see a lot. And then thyroid disease, over and over again, either patients with hypothyroidism, patients with hyperthyroidism, or patients that are convinced they have a thyroid problem because they're losing hair and no one can figure out why, and therefore it must be their thyroid, even though they've had normal thyroid tests. So it comes up over and over, like every day in my practice. You will not meet an endocrinologist that has not been gifted a bag of hair by one of their patients. They bring in hair in baggies to demonstrate how much hair they're losing, because it really is distressing to them, and they want to show you, like, yes, I really am losing hair. And so, we all laugh about it, but it really is, it's a problem. Another newer place is the post-bariatric patient population. When patients have weight loss surgery, then they tend to have a lot of hair loss after weight loss surgery. And so these are a lot of people that I take care of before surgery, and then they end up having surgery and they continue to come back to me for their diabetes or whatever else is going on. And now suddenly they're complaining of hair loss as a side effect of the surgery. Sometimes it's vitamin deficiency related, and sometimes it's just triggered by massive sudden weight loss can trigger hair loss. So there are all these places in my life where I see hair loss all the time, and there isn't necessarily anything that you can do for it. You can treat the underlying medical condition, but it doesn't necessarily speed up the problem that the patient's having. And then we see a lot of issues with hair loss where there's not a definite answer. Patients come in thinking it's their hormones, because what else could it possibly be? And there are so many hormonal causes, and yet it turns out not to be that. And then it's kind of like, well, what do we have to offer anybody? So in terms of something that was really appealing to me, this was great, because I knew that women do not like to be told to use Rogaine. That's just not something that makes them happy at all. And they don't stick with it. And then if they don't stick with it, then they tend to shed a bunch of hair afterwards. And so I just felt like there were a lot of people out there that potentially could be helped if I could help spread the word about, this shampoo product that actually works for people. And so that's kind of how my mind got into it, in terms of jumping in and just getting involved. But at the same time, I'm not a salesperson. That's not what I do. I'm a doctor. And so, yeah, I can talk to people because I talk to patients all day long, but I don't know how to sell anything, and I have no marketing background. And that kind of stuff honestly makes me feel really awkward and weird. And so I still wasn't sure exactly what I was going to do with this. And probably a week or so after I'd signed up, not even a week after I'd signed up to do this, then I was at our endocrine conference down in Austin, Texas, and one of my partners, well, a bunch of my partners were there with me, but one of my partners and I were hanging out, and I was telling her that I had just signed up to do this, and I wasn't quite sure what I was going to make of it yet. And she was so enthusiastic about it. Just the whole idea that, wow, there's something out there that, we can tell patients about. This is amazing. That, there might be something to offer people. And so getting that reaction from her and from some other people that I had talked to who were just so excited that there could be something really made me feel like, I need to make a go of this and do something. And so it ended up happening kind of naturally, where, yeah, of course, you make your first sales to your family and people that you know and that are easy, like, hey, try this stuff, it's really great. And surprisingly, my super picky sister actually really, really likes it. And she was the one I was probably most nervous about. I was like, please let her like this stuff. She sends everything back at restaurants and things like that. And so she's trying product and actually liking it, and it's all good. So they starting there, but then moving on towards, people that I'm meeting online that are talking about hair loss, other physicians that are having issues themselves with hair loss, and then moving into the world of patients, which is a little tricky to navigate, because I want my patients to have this as an option, but I don't want to be selling something directly to my patients in an exam room, and making them feel like they need to purchase something from me. So I've got that figured out now, where I have somebody that works with me, and I can refer my patients to that person for purchasing, so that they don't feel like I'm giving them a hard sell in the office and that they are going to be turning their money over to me. And that feels comfortable to me. If I had an office like a dermatology office or a plastic surgery office where people just put products out front, then it might be feasible to just set stuff out front and let people ask if they were interested. But my office isn't structured that way. And in fact, I've got a weird setup in my office where I'm in private practice, and I'm the only private practice person that works in an office space with a bunch of employed endocrinologists. So it's not my own office. I can't decide what to do with the space or how to work that. And so I've got to make sure that I do things appropriately from the standpoint of how our office works. But I still am managing to give patients information, and I end up talking to them quite a bit about hair now. Not that I didn't talk to them quite a bit about hair before, but they potentially left unsatisfied, whereas at least now I have something that I can mention or offer. So it's funny because now that I have this as something that's going on, I mean, it's not a day goes by where I don't see a patient that's talking about hair in some way. It's on our sheet where patients circle their review of systems in terms of complaints and, over and over again. Then there are patients that don't complain of hair, and I'm looking at them, examining them, and I can see the top of their head, and I'm thinking, you are having a hair problem. I'm not going to, make you concerned about it if you're not already, but I see a ton of hair loss, and you end up staring at everybody's heads. I stare at everybody's thyroid glands because this is what I do. So, I see people on TV and I'm diagnosing thyroid nodules because I see people on TV with thyroid problems, and now I'm doing the same thing, but I'm walking around in the general world and looking at thinning hair thinking this person needs Monat, this person needs Monat.
Yes, they're everywhere, right?
Yeah, I know, it's very distracting. You can't just talk to people anymore without thinking this person needs some shampoo. Please let me help you, but I don't want to be rude.
Yeah, this is why the Monat reps are known to be sort of crazy, because we see them everywhere, right?
Yeah. So, it's hard for me, to kind of separate this concept that I'm a physician and yet I'm also doing this as part of sales. And how do I separate that? I'm like, these people are actually customers and not patients. Because in my mind, in a lot of ways, they're both, because they do have some of each thing going on. Although I do try and make it clear to people, I'm not working with you as your doctor when I am suggesting that you use Monat, because if I'm, long distance with somebody and I'm a physician and they're going to try Monat, but have not established a relationship with them, then I need to be their salesperson and not their long distance doctor. And I do try and make that clear if people know that I am a doctor when I'm selling them this. And I think that's kind of a line that all physicians potentially have to walk a little bit, in that if we are recommending something that's helpful for something that is cosmetic, but is also potentially a medical condition, that we are not necessarily treating people, but we are still salespeople in that circumstance. And that's, I'm decent, I think, at making that clear and not making that, awkward for people or myself. But I do like to clarify that, because at least, maybe not in Canada, but in the United States, then, we worry all the time about being sued. So when you establish relationships with people, then the question is, what is the nature of that relationship? So I think I'm forming relationships with people where they do understand that I am their Monat supplier. And it's really fun. It's fun to do something that's actually not being the doctor. I could supplement my income by just working more hours as an endocrinologist. But for every hour that I work seeing patients, then that's more paperwork that I have to do. Well, not paperwork, but online charting that I have to do. For every hour you spend, then there's all the background stuff with prescriptions and prior authorizations to get things covered and reviewing labs. It's not just 1 hour of your time, and it becomes a lot. And so moving my time, if I'm going to spend it working, and spending it doing something else in order to generate income, makes it a lot more fun. And it's nice to have it as a distraction or something where I feel like, I'm doing something, but it's just not more charting or more of the stuff that's sometimes frustrating. I enjoy the time that I spend with patients, but some of the time that you spend afterwards just slogging through all of the stuff is frustrating. The other thing you may not know about endocrinologists is that we are at the bottom of the food chain when it comes to pay in the field of medicine. So despite the fact that we do have 2 or 3 years of additional training beyond internal medicine, then we are paid less than internists, and we are paid less than pretty much any other specialty. So
Can I ask you really quickly, how long is your education?
So we do, 4 years of college, 4 years of medical school, 3 years of internal medicine residency, and then 2 to 3 years of endocrine fellowship after that.
Oh my goodness. So it's like almost 14, 15 years.
Yeah. So I was in my, 30s by the time I was done. And so part of the reason for doing something like this is, now I have kids who are both, I mentioned my daughter is going to be going into high school. I have two kids who are going to be in private school for high school. And I've got one son who's going to be a junior. So we've got college staring us in the face. And suddenly I'm like, oh my gosh, I didn't help save for grad school for my kids. And, college just seems so far away. So the idea of coming up with a way to potentially help pay for some things with regard to that, or just put more money towards retirement. I'm at I'm probably halfway through my career at this point, my medical career, and I'm pushing 50. And so if I'm looking at when I'm going to retire, I have to start thinking about how to allot my income in terms of how much goes towards retirement and how much goes towards things that we're paying for the kids. And I don't want them saddled with a ton of educational debt, and at the same time I'd like to be able to retire at some point and not be working because I'm paying for their education for the rest of my life. And so this is kind of a fun way to potentially increase my income and in the long term, hopefully increase my income significantly. I'm not in it obviously I'm in it because I think there are a lot of people that can be helped. But from a financial standpoint, I'm also looking at kind of the longer term. And I just think there's so much potential with this company getting in at this period of time where it's not huge yet, but it's growing so rapidly. And there are a lot of people that we can reach. And I know what an enormous need there is. I mean, I personally just know what an enormous need there is for this product.
So can I ask you another question? I
Sure.
just hate to interrupt you. I've got so many questions I want to ask, but we don't have enough time. But so in your experience in being endocrinologist, how many years was that?
So I've been an endocrinologist since 1999. I finished my fellowship in 1999.
Okay, so in your experience, would you say that there has been anything effective dealing with hair loss that is in this non-toxic world or even in the toxic world?
Not at all, really.
Wow.
Not at all. So, all we really have to offer people is treating the underlying condition. They've started, I guess, to use a little bit more things like finasteride, which is for men for hair loss, is an oral medication in women. But other than that, it's been around for a while, and they've moved towards using it a little bit in women. But no,
So basically, there are side effects I've read with the finasteride.
Oh,
That
yeah,
one.
exactly.
So every other product that you know of has side effects except for Monat.
Yes, absolutely.
That's
Yep.
incredible.
Yep. No, it really is. And so just the fact, if it works for some large percentage of people, even if it doesn't work for everybody, I'll take care of dealing with whatever underlying hormonal issue there is that might be contributing to the hair loss. But if you can help regrow some hair, you know what I mean, and help with that at the same time, if it's effective for some portion of people, that's a huge portion of people, more than nothing is effective for it.
And have you noticed in your experience being in Monat, because it hasn't been very long, but have you noticed yourself with the people that you've given it to or recommended it to, have you noticed dramatic results?
Yeah, I have. And so, I just from the standpoint of people saying that it's helping them with growing in hair. My daughter is using it. I got my product pack and I distribute it among everybody in my family. My daughter's 14 and, so she's trying it and loves it. She wants to be my sales assistant. And I'm like, that's fine. I'll pay you to be my sales assistant. We'll start saving for your retirement. But I went to cut her bangs a few weeks ago, right before we went on vacation. Her bangs had gotten super long because they were growing really fast. And she had all of these sprouts of hair on the back of her head, like all up here. She has all these sprouts of baby hair. I wasn't looking to grow this kid's hair. She has plenty of hair. But it was just interesting to see that in a situation where I wasn't looking for anything at all other than, manageability and, nice condition of her hair, that she just was like a textbook example of hair growing really fast and boom, sprouting off the top of her head. My best friend is a dermatologist and she started using it a month ago. And she called me a couple days ago, kind of ripping on me to say that she had checked her calendar because she was trying to figure out when her next color appointment was. And she discovered it wasn't for 2 more weeks. And her roots had grown out so fast that she always books out like every 6 weeks. And she's like, well, my hair appointment must be coming up. And she's like, are you kidding me? It is not for another 2 weeks. So just in the month that she's been using it, her hair grew so fast that, yeah, she's like 2 weeks ahead of schedule. So 50% more hair growth than what she normally was expecting to use. So I told her we're going to get some root cover up so that she wouldn't be paying for hair.
Yeah, that is the one negative. It's true.
Yeah.
So the other question I have is the S3 internal supplement. Do you find anything that conflicts, or is it have you researched how it is?
I haven't researched it per se. I mean, what I saw with it, a lot of it, there's biotin in it, obviously, which is a big thing that's known for hair. Like if I have a patient come in with biotin on their medication list, I know we're talking hair at some point when they're in my office because, people, that's the main place where people are taking it, especially if they're taking it as a supplement in and of itself. So no, I haven't really looked into all the details about the S3 supplement per se. And, I haven't been recommending that for people as much as the topical treatments.
So even just the topical stuff is good enough for you, and you've seen results with that.
Oh yeah, absolutely.
That's incredible.
Absolutely.
Okay, and then the last question I have, or one of the last questions, is the conflict of when I'm presenting it to doctors. Usually I get the door kind of slammed in my face because I'm a door-to-door kind of girl. So is there something that you would recommend for people who are doing my version of this business to help doctors see the light, so to speak, because they get prospected all the time? Like, do you have
that's a good question. A lot of relationships with like reps with doctors and stuff, honestly, is a lot of it's personality. The biggest thing I could ever tell anybody that's repping any kind of product is do not be annoying and do not be pushy and just show me some information. Don't cram anything down my throat. And so that's kind of hard if you're presenting somebody with a new product that they might not have seen before. So I would say truly valid before and after pictures, and then the science behind it. Having the scientific papers is really, that was one of the first things I looked at. That when Vicki and I were texting and I was trying to figure out if I was going to sign on, and she was sending me pictures, and she was sending me pictures of her upline who had done so well with money, and her sister, and real human beings, as opposed to like examples of somebody from a brochure or something like that. I was like, okay, these are real live people that and then she sent me the scientific information about it and the main paper that was published. And I found that very useful to see that there had been true scientific studies done. And I think that really is probably the best way to approach physicians, is with some science, and then just with the idea that there isn't anything else. What else do you have to offer people at this point?
How many meds are actually out there for hair loss that you know of?
There isn't anything really that I can think of other than minoxidil that's specifically for hair loss. Everything else we kind of borrow. We borrow spironolactone, which is a diuretic or water pill, and that we use in patients with excess hair growth on their, on the rest of their body, and that also sometimes helps a little bit with hair growth when they're losing on their head, because it blocks testosterone, the level of the skin. And so that, that's one thing. And then the topical minoxidil, I'm trying to think of what else. Then there's the finasteride, but they're really, that wasn't developed just for hair loss. So there's not really much out there besides minoxidil.
And when you said women don't want to use or stick with Rogaine, and why is that?
I think some of it is they don't like the feeling of the product. I think it's a lot of the times it's the inconvenience of having to do that and the feeling.
Because it's sticky?
They don't like what it does with their hair, or what it does with their scalp. That's some of the complaints that I've heard. And I've had patients say I tried the foam and I tried that they've tried different versions of it and they still haven't been happy with it.
But does it make their scalp itchy or something, or what does it do?
No, I think it sometimes leaves like a layer almost on the scalp, or they just don't like the way that it leaves their hair feeling after they've used it. And because it really is a scalp treatment, it's not a hair treatment. And so, you're kind of sacrificing the hair in order to put something on the scalp, as opposed to Monat, where you're treating the hair and you're treating the scalp all at the same time.
Yeah, and it has zero residue. Whereas, like you said, when I as a 25-year hair colorist, you do a beautiful blow dry on somebody, and then they say, 1 second, I got to put this stuff on my head, and then they just put this sticky stuff all over their head and just ruined your blow dry.
Yeah. So true. So true. So, no, so the other thing I think is that women don't like being equated with an old balding man. You know what I mean? When you're told use Rogaine, that's kind of what they think of as some desperate, 50-year-old man who's got typical male pattern baldness. They don't want to be that guy. And so I think they're not excited about it. So I have very few patients who are on Rogaine that have stuck with Rogaine. I have a couple, but not many.
And that thing where when somebody uses Rogaine or Nioxin that have the active ingredient minoxidil, when they're using it, once they stop, Why does the hair fall out?
I don't exactly know,
But it
honestly.
does.
Yeah,
But
oh
it
yeah,
does.
definitely does. And so that's the other thing. And sometimes people don't want to start it because they know they've heard that if they start it and they stop, then their hair is going to fall out. And so, people have asked me about Monat and whether or not hair falls out. And from what I understand, yes, it can eventually fall out because you revert to your normal. In my mind, because I'm also thinking about underlying causes for hair loss, some of it is if in the meantime you fixed whatever triggered the hair loss to begin with, then that may not necessarily even be true. If there's a postpartum woman who's lost a whole bunch of hair and then you give her Monat and a few months later, she's probably going to love Monat by that point, but she's going to grow some hair back. But she's not probably going to lose huge amounts of hair when she stops using Monat because she's not in this acute postpartum phase anymore. Whereas somebody that has androgenic alopecia with polycystic ovary syndrome or something like that, where they chronically have elevated levels of testosterone, you take away the Monat and it's, they're going to revert to where they were before. So I think some of it is, was there a transient trigger to things or not? And
I have another question. Sorry, I have so many questions to
sure.
ask you because you're so knowledgeable. Is when you have people that are really sick and they're on lots of other medication, and then we
Mm-hmm,
present them because we know this condition has hair loss issues, and then
mm-hmm,
we say, well, just try. If you don't want to use the S3, the
mm-hmm.
internal supplement, you could
Right.
use the topical. Is that
Yep.
in conflict with their medication when it's
No, I really don't think it would be at all. I truly don't think it would be. And because it is just topical, and so it should be.
there's that other condition, like other, say for example, people with lupus or people
Mm-hmm.
who have, I don't even know the Hashimoto's. I've heard this too, right?
Yep, that's
Uh,
thyroid. That's my deal.
is that you, Hashimoto's?
Yeah, that's me. Oh yeah, I'm Hashimoto's.
But sorry, what is the Hashimoto thing anyway?
It is Hashimoto's is autoimmune disease of the thyroid, and so you have antibodies that go to the thyroid and damage the thyroid, and generally cause it to over time stop producing enough thyroid hormone. There's some women that have the antibodies and they have not yet become hypothyroid. So the antibodies are just a sign that they have autoimmune disease of some kind. And sometimes those women lose hair, and we don't understand exactly why. It may be some type of autoimmune hair loss, but it's not. We don't know if it's related to the thyroid antibodies or some other antibodies that we don't know how to measure yet, but they're linked in the same gene or something like that. But Hashimoto's is the most common cause of hypothyroidism, and it happens in like 1 in 9 women. I mean, it's not an uncommon thing at all. And so, yeah, right there, just Hashimoto's, there's a huge potential in terms of people that, you know,
And do you know anything about people with lupus?
so yeah, people with lupus lose a lot of hair. People with all rheumatoid arthritis, like what I have, is another rheumatologic disease. But any rheumatologic disease, then there can be a lot of hair loss. Some of which is related to the autoimmune stuff again, and sometimes it's related to the medications that are treating the autoimmune disease. And so it's a catch
So
22.
fascinating. Okay, and then the last thing I was going to ask you, because this is the last thing, sort of, is the washout period. When you say someone wants to get off whatever that medication is, to wash out the medication, they have to wash it out?
It literally, that one particular medication that I was on gets stored in your body, and the only way to get rid of it is to use this resin to bind it, and it actually then ultimately gets rid of it in your poop.
That
But
sounds so weird.
I
Like,
know it is. I know. Otherwise, it kind of gradually goes away over time. It's one of the few medications that are like that. And otherwise, you can just let it, let
do you
it.
know anything about Propecia?
I don't know a lot about it. I certainly know many people that take it, but in terms of, it's just a smaller dose of finasteride, basically.
But there
Um,
are side effects with that stuff.
Yep, yep, there potentially can be.
And
I
what
have
are
a
the
friend. I have a friend that was telling me that her significant other was taking finasteride instead of Propecia because it was cheaper to get it that way. And then it turned out that he was accidentally taking a much larger dose because the Propecia dose is a smaller dose. And I was like, oh my gosh, I'm freaking out.
well, but what are the
But he
side
was worried
effects
about side effects.
what are the side effects that are in a nutshell for non-doctor people?
I honestly, I don't know all the side effects off the top of my head. I mean, it's treated for, it's used for prostate and things like that, but I truly don't know all the side effects because I don't prescribe it. You usually Propecia for men, it's prescribed for hair loss, but the main finasteride is usually prescribed by urologists for prostate issues and things like that. And then I actually have avoided prescribing it in women because for a long time it was recommended to avoid prescribing it in women because they can't get pregnant on it. It's potentially dangerous if they were to get pregnant and things like that. So it's not an ideal drug for,
That's
A
incredible.
childbearing age female to be on,
Incredible. Okay.
which is
So,
a huge portion of these patients who are losing hair.
oh my gosh, it's seriously incredible, Jen. Your knowledge is just, I could talk to you all day. It's so fascinating. So the last thing, because usually medical doctors tend to be very skeptical and kind of know it all. Hate to say that,
Mhm.
kind of know it all because you really do know a lot. What made you actually, because you're saying, no, I was actually pretty open to it. I actually find that most medical doctors are not open to it. Or is it because I'm not a doctor sharing it that it makes medical people a little bit more skeptical of anyone non-medical doctory?
That's a good question. I suspect people would be more receptive to somebody else that's in science. I think that probably is true. Um, and I was receptive to it. I think partly because I knew there was nothing else, and because of my personal experience with hair loss. I kind of have two places where I feel like I always empathize with my patients more than normal, and one is weight, because I'm one of those people that struggle with my weight and I'll do everything exactly right and I can't lose. And the older I get, the more true that is. And I have so many women come in complaining of that issue. And so, for years I've been like, I feel you, sister. We're in the same boat. If I had anything magical I could give you to help you lose weight, I'd be doing it and then I'd be sharing that. Now I'm doing some intermittent fasting stuff and sharing that information with patients. But in general, like that's been one big issue that I share with patients. And the other issue that I've kind of shared with my patients is hair stuff. So when they come in, they're complaining about hair and hair loss. And I've always felt like, I know exactly what you're talking about. I've been there. I've panicked over it. I totally get this. And I got nothing. Other than figuring out how to deal with the underlying hormonal stuff, which they may or may not have. But the one thing I really hate is when somebody comes to see me and there's not anything that I can give them or do for them. I feel like people leave unhappy. I think there are a lot of people that think that doctors don't care, or that there's a lot of suspicion out there about physicians thinking that we either don't want them to have things, or we don't care, or we haven't done enough, or there must be something, and sometimes there just isn't. And so the idea that, like, in this particular circumstance where supposedly there was nothing and I might turn somebody away saying I don't have anything, that maybe there could be something. um, I don't want people to not know that there might be something, because people just want some kind of hope that they might be able to get better. They don't come in just because they like to kill time in the doctor's office. They come in because they're genuinely concerned about something. And for all the people that come in, there are all these people that I'm looking at passing on the street going, oh, that person's thinning or whatever. There are all these people that aren't going to the doctor. So I just
So for anybody who's a doctor watching this thing now, what would you say to a skeptical doctor?
I would say that it works. I really do think that the products work. And I have seen many situations with it. And then just in the short time that I've been involved, I've physically seen, patients or customers doing, well with this. I would say that if you're interested in getting involved, then regardless of whether or not you want to sell it to your own patients versus just develop a customer base, that it's something that's really helpful for people. There's actually a huge need for it, where if we can get it out there in some way, that is really, that's kind of my goal, I guess, is to just let more people know that it's out there. They don't have to buy it from me. They do not have to buy it from me. I just want people to know that it's available, because it's better than nothing, or what the current options have been. And then the last thing is that it's not that hard if you're interested in selling this or doing this. I'm not a natural salesperson. This is not what I signed up to do. It's completely random. It feels completely random that I somehow got involved in anything direct sales. But because it kind of relates to what we do and things that we see every day, then it's something that makes a lot more sense and feels comfortable, so that I don't feel icky selling something.
Well, especially if the product works.
No, it makes me happy to be able to, get it out there and offer it to people, because I think there are people that really will be so relieved that they have something, anything. And so, it, no, I'm thrilled to be able to have it. I'm thrilled to have it for myself. I'm thrilled to be able to, get the word out to other people. And, I think it's actually a good fit with medicine in terms of what we do, and a good complement to what we do. Yeah, and it works.
I just wanted to thank you for honestly answering all my gajillion questions. Normally it's a 3 to 5 minute testimony,
Oh, gee.
but because we had to, okay,
problem.
so whoever sent you to this video, please go back to them if you have any other questions. Yeah, and we had to do the doctors separately because the doctors are so hard to pin down because your schedules are so crazy. But honestly, Jen, thank you so much for sharing your knowledge because I know this is going to help so many people. And when you're in a position of of the doctors, you can just imagine you guys are the people go to for solutions. So when you actually have one that actually works, I can imagine why you're so happy.
Yeah, no, it really is. It's exciting to be able to, put it out there for people, for sure.
Well, thank you so much for your time, and big love, sister. Honestly, it's so great. It's so nice to meet you as well.
Nice
So
to
thank you,
meet you.
everybody.
Yep.
Okay, take care, Jen.